Hello, my name is Hye-mi Choi. I'm RN, FNP student. I'll be performing a physical exam today. This is Mr. Young. He's a 37-year-old male with no known allergies or no known medical histories. When he first came on, I asked him to empty his bladder, got his height and weight, took his vital signs. His weight is 175 pounds. His height is 5'9". Vital signs stable and denies of pain at this time. General appearance. His skin color is appropriate to the race. Posture is relaxed. Mood is appropriate. Appears to be slightly tired. He's well groomed. Dress is appropriate to the weather. His ANO times 3. Speech is clear and coherent. When he first walked into the clinic, I noticed his gait is balanced and steady. I'm going to start with your head. I'm going to touch your head. Let me know if you're having any pain. I'm going to check the scalp for the lumps, lesions, any bulging. I'm going to check the skull for depression, bulging, and any lesions. And patient does not complain of any tenderness with palpation. His hair is thin and shiny and healthy. And I do not see any signs of hair loss. Can you smile for me? Can you frown? Okay. Can you move your eyebrows? Okay. Cranial nerve number 7 is intact. Okay. Can you open your mouth? Okay, close it. Okay. I did not feel any crepitus, did not hear any popping sounds, and his cranial nerve number 5 is intact. Can you feel this?
Yeah.
Good. I'm going to touch your face with it. Let me know where you feel.
Cheek.
Good.
Head. Chin.
Good. Cranial nerve number 5 intact. You can close your eyes. Can you smell? Okay, what do you smell?
Mint.
Good. Cranial nerve number 1 is intact. I'm going to ask the patient to read the Snellen eye chart, read the smallest letter that he can read. And his vision was 20/20. He was able to distinguish the color, to check for the color blindness, and his cranial nerve number 2 is intact. I'm going to check for your sinuses. Okay, I'm going to check the frontal sinus, check for bulging, any tenderness,
No.
okay, and maxillary sinus, and I do not feel any bulging. Okay. Now I'm going to take a look at his eyes. His eyebrows are symmetrical. His anterior chamber is clear. His iris is brown in color, round and regular. His sclera is white in color. I do not see any signs of exudate, drainage, redness, infection. Okay. Can you close your eye really tight for me? Good. I'm going to try to open it up and you're going to resist me. Good. Very good. Okay. I'm going to pull down your eye. Check for conjunctiva. His conjunctiva is pink, moist, and clear. I do not see any signs of infection, any redness, or any drainage. Now I'm going to check the size of pupil. It's 3 millimeters bilaterally. I'm going to dim the light and flash the light in your eyes. Okay, you can take a look at the wall. Now can you follow the light for me? His cranial nerve number 3, 4, and 6 is intact. I'm going to flash the light in your eye again. Optical disc noted. Retinal vessel noted. Macula and fovea noted. Okay, now I'm going to check for your nose. Okay. His septum is in midline. No deviation noted. No swelling noted. I'm going to palpate your nose. Let me know if you're having any pain. Now I'm going to take a look at inside of your nose. His nasal mucosa is pink and moist. No signs of drainage. And no infection noted. Okay. Now can you cover your right eye for me? I'm going to check for your peripheral field. And when you see my hand, let me know. Say now when you see my hand.
Now. Now.
Good.
Now.
Good. On the other side.
Now.
Good.
Now.
Good.
Now.
Good. Okay. Now if you can cover your right eye for me. Uncover. Cover. Uncover. Okay. The other side. Good. Uncover. Cover. Uncover. Good. I did not see any deviation and they're equal. I'm going to check for the temporal artery, temporal pulse. Okay, and they're +2. Okay, now I'm going to take a look at the ear for any drainage, infection, any redness. Okay, I'm going to touch your ear. Let me know if you're having any pain. Any pain?
No.
Good. Okay. Now if you can turn around. Okay, I'm going to take a look at your ear. To pull it up and back. No redness, no signs of infection, no drainage. A small amount of dry yellow flecks noted. Tympanic membrane is pearly gray in color. And cone of light is located at stigma cloud. Now I'm going to whisper a word to you, and you're going to repeat it back to me.
One pink coat.
Good. Okay, if you can turn around for me. I'm going to place a metal object on your head. How do you feel? Do you feel the vibration on one side more than the other, or is it the same?
Something like
Good. There's a normal finding. I'm going to place the metal behind your ear and next to your ear. Which one do you can you hear better? Is it behind the ear or next to the ear?
next to you.
Good. That is a normal finding. And his cranial nerve number 8 is intact. Okay. Now if you can open your mouth for me. I'm going to check for the cavity and check the gum for any change in color. Check any sores, lesions, any signs of infection, redness. His mouth is moist and pink in color. There's no cracking of lips, no sores of his lips, and it's pink in color. You say ah. Good. His uvula is in midline, and his cranial nerve number 9 is intact. Tonsil is not in place. Patient has a history of tonsillectomy at age of 9. Okay. I'm going to place a tongue depressor on back of your throat. Good. Okay. Gag reflex is intact, and cranial nerve number 10 is intact. Okay. Can you shrug your shoulder for me? Good. Cranial nerve number 11 is intact. Can you stick your tongue out for me? Good. Cranial nerve number 12 is intact. Okay. Now I'm going to check for the trachea. Is it midline? Okay, I do not feel the swelling of thyroid gland. Okay. Now if you can turn around for me, please. Trachea goes up and down, moves up and down with the swallowing, which is a normal finding. Okay. I'm going to palpate your spine. Let me know if you're having any pain. Any pain?
No?
Okay. Can you say 99?
99?
99?
99?
99?
99?
Good. Tactile fremitus is intact throughout. I'm going to listen to your lung sound. Take a deep breath. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe out. Good. Okay. I'm going to place my thumb on the 10th rib cage. Can you take a deep breath for me? Breathe out. Good. Okay. Lung expansion is symmetric on both sides. Lung sounds clear. No apparent respiratory distress noted. And no use of accessory muscle noted. Okay, I'm going to percuss your lung field. Okay. Resonance present around the lung field with percussion. I'm going to punch your back. Let me know if you're having any pain. Any pain?
No.
Patient denies of CVA, tenderness. Now I'm going to check for the lymph node. I'm going to first check for the carotid pulse. Okay, it is +2 and +2. I'm going to listen to the beat. No bridge present. Okay. That's pre-auricular, post-auricular, occipital, jugular, cervical, supraclavicular, subclavicular. I did not feel any firmness or any swelling of the lymph node, and patient does not complain of any tenderness with palpation. Okay. Now I'm going to inspect the chest. I'm going to see if there's any, I'm going to check for the symmetry of the breast. Check the nipple for any discharge. If it was a female patient, I will ask the patient to lean forward and relax. Put their hands on the side and check for the symmetry, any lumps or change on the breast. Now I'm going to place my hand on your chest, feel for any thrills and heaves, which is not present. I'm going to place my hand on your PMI. Now I'm going to listen to your lungs, a heart sound. Aortic, pulmonic, earth point, mitral, tricuspid, and mitral. Okay. His heart sound is S1, S2, regular in rate, no extra sound noted, and no murmurs noted. And his lung sounds are clear. I'm going to check for the JBD in 30-degree angle. I do not see any signs of jugular vein distension. If it was a female patient, I would ask the patient to place their hand back off their head, make sure their breast is flat, and check for any tenderness, firm lymph node, change in color, any discoloration. I will start from outer breast with a circular motion towards the nipple and check for the discharge and dimpling of the nipple. Okay. Now I'm going to take a look at your abs. I will first inspect for any bulging, any pulsation, and movement with the respiration. I'm going to listen to the bowel sounds. aorta for any glutes, and femoral artery for glutes. I'm going to perform a light palpation. Can I do breathe in, breathe out? Right kidney, no palpable. Breathe in, breathe out. Liver, non-palpable. Breathe in, breathe out. Spleen is non-palpable. Breathe in, breathe out. Left kidney is non-palpable. Okay. Vowel sound is present in all four quadrants. Abdomen is soft, non-tender to palpation, non-distended. Now I'm going to percuss your ab. And tympanic sounds present with the percussion. Now I'm going to check the range of motion and the strength of your lower extremity. Okay. Can you press down on my hand? Press it down. Good. Pull it up. Good. Now this time. Push it down. Okay. Pull it up. Good. Okay. And this flexion, extension, adduction, and adduction. I'm going to check for the Babinski sign, which is normal finding with the dorsiflexion, with extension. I'm going to touch your leg. We're going to do the range of motion. His strength on the ankle was +2 with the dorsiflexion and extension. I'm going to do a flexion of your knee. Extension, good. And we're going to check for your hip now. Okay. Adduction, adduction, good. Okay. Okay. Going to flex your knee. Flexion, extension, adduction, and adduction. Good. Okay. For range of motion, it's present on ballet lower extremities. Okay, now can you pull your leg up for me? Pull your leg up. Good. I'm going to try to press it down. You're going to resist me. Good. Strength is +2. Now I'm going to try to pull it up. You're going to resist me. Okay, strength is +2. Now if you can take a sit for me. Can you place your feet on the shin and bring all the way down? Good. Okay, on the other side, pull it up and all the way down. Good. Okay. I did not see any deviation while he was moving his feet, and which is normal finding. I'm going to check for the pulse. His brachial pulse is +2. His radial pulse is +2. No signs of edema on the upper extremity. I'm going to check for the nail bed. It's pink in color. Can refill less than 2 seconds. Nail is 106 degrees. Convex, clear. I do not see any signs of clubbing. And it's intact. Okay, I'm going to check for skin trigger, which is less than 2 seconds. Okay, I'm going to check for the femoral artery, which is +2. Popliteal artery is +2. Posterior tibial is +2. Pedal pulse is +2. And there is no edema on the lower extremity. And his skins are warm to touch. So far, I did not see any signs of skin breakdown. Okay, now I'm going to do a reflection. I'm first going to check for. I'm going to first check for the tricep muscle. Relax. Okay. And it's +1. I'm going to check for the bicep. Okay, which is +1. And brachial. It's +1. Okay, I'm going to check for the patellar reflex. Good, +2 patellar reflex. +2 of Achilles. And +1 of plantar reflex. Now we're gonna make a fist for me. Okay, I'm going to try to open, and you're going to resist me. Good. Good. Okay. Now we're gonna open it up. I'm going to try to put it together, and you're going to resist me trying to put it together. Good. Okay. His strength is +2. Okay. Can you follow me? Flexion, extension, adduction. Okay, now we're going to check for your elbow. Flexion, extension. Okay, now we're going to bring it all the way back to the back of your head. Okay, down. Okay, and supination, improvation. Good. Can you put it down for me? Okay, can you put your arm up for me? I'm going to try to pull it down, and you're going to resist me. Okay, strength is +2. Strength is +2. Okay. Now I'm going to check for the scrotum, check for any lesions, scars, swelling, and irritation, infection around the area. Check the testicles for symmetry, any swelling. I will check for the penis also. If it was an uncircumcised male, I will retract his foreskin, and I'll check the meatus for any redness, any discharge. For female patient, I will inspect the labia, around the labia, check for any redness, infection, and drainage from vagina. Okay, I will locate the Bartholin's gland and strip down the meatus. I will get the specimen before I place the lubricant on my finger. And I'll place my finger into vagina and locate the cervix. Then I will ask patient to bend, check rectum for any fistula, signs of infection, prolapsed rectal mucosa. I will place my index finger with the lubricant, check for any swelling of the prostate gland, and locate midline fissure. So now I'm going to do the sound. Okay. They're sharp and they're dull. I'm going to touch you, can you tell me what kind of a sensation you feel?
Sharp.
Cool.
Dull.
Good.
Sharp.
Good.
Dull.
Good. Now if you give me your hand, I'm going to place an object in your hand and you're gonna identify that for me.
Wing.
Good.
Cone.
Good.
Key.
Good. Now I'm going to write a number on your palm and you're going to tell me what number it is. Okay, close your eyes.
1, 5, 7.
Good. Okay. Now if you can open your eyes, you're gonna point your nose with your finger and point on. There we go. Not this side. Good. Got it. Okay. Now I'm going to check for the range of motion on your neck. Now follow me. Chin to the chest. Okay. And extension. To the left. To the right. Okay. Full range of motion of the neck noted. Okay. You can stand up for me. Can you stand with, can you close your eyes? Okay, I will check for 20 seconds. Okay, make sure he's balanced. It's good. Make sure the patient doesn't fall. Now can you stand with your one foot, one leg? Good. Now can you alternate your legs? Good. Okay. Now can you walk with your toe? Good. Now can you walk with your heel? Good. Now can you jump? Good. Okay. Do you have any questions or concerns at this time?
No.
So this completes the physical exam today. Thank you.